All right. All right. How's everybody doing today? Hotep, everybody share this broadcast on your Facebook page. Invite your friends to tune in also. Okay, it is Tuesday, March 3rd, 2020, and we are live. This is Michael M. Hotep, founder of the African History Network, host of the African History Network show. I'm a talk show host, researcher, lecturer, writer, and historian. So I wanted to do an update on what's taking place with the coronavirus. I talked about this on my Sunday night show, the African History Network show, and we gave you a lot of helpful information about what's taking place, how it's impacting the stock market, some history dealing with how for the past 2 years, Donald Trump has been slashing programs and health programs, whether it's the CDC or different health departments that would monitor the coronavirus and really plan the response ahead of time. Okay, so we have some updates that have taken place. We see that the U.S. is now reporting 9 deaths as the coronavirus spreads. We saw today the Federal Reserve chair Jerome Powell cut interest rates by 0.5 percentage point. We also saw the Dow Jones Industrial Average close down almost 800 points. We know last week the Dow lost 12% of its value, or about 3,583 points, or 12.4% of its value last week. And also worldwide, we see about 3,100 deaths from the coronavirus. It's spread to about 57 countries. Okay, so we're going to give you an update on what's going on. We're going to give you some sources so you can research this yourself, as well as you always hear me say, proper documentation ends all conversation. You don't have to believe a word that I say. Go research this yourself. We're going to look at the live updates from the Washington Post, as well as NBCnews.com. I've been looking at the live updates from the Washington Post, NBC News, as well as New York Times. Okay. And we're going to look at some history here also. I'm not sure who this is calling me. We're going to look at some history here as well. Okay, so let's see who we have here. Shirley and Cheria, Dolores, Karen. Everybody share this broadcast on your Facebook page. And then African American business owners, post the name of your business here on the thread of the broadcast. We'll let you know how you can advertise with the African History Network. Email us at customerservice@africanhistorynetwork.com, customer service at africanhistorynetwork.com. All right. Okay, so if we, and let me flip back over here. Okay. Let's flip back over to this. All right, so if we look at the live updates from the Washington Post at washingtonpost.com, let me flip back over to this. So we see the U.S. reports 9 deaths, 9 deaths so far from the coronavirus. The state of Washington reported new deaths from the coronavirus on Tuesday, March 3rd, 2020, raising the U.S. death toll from the virus to 9. Now, there has been a shortage of testing kits to be able to test for the virus. As more testing kits are made available, you're going to see the number of people who have the coronavirus skyrocket. All right. Also, contrary to what Donald Trump is saying, Donald Trump is really at war with the scientists. You had scientists who testified in front of the U.S. Senate today, including Dr. Anthony Fauci, who is one of the leading scientists and doctors dealing with this field and dealing with diseases, et cetera. And contrary to what Donald Trump is saying, where he's saying he was at a rally last night and he said that a vaccine is months away. No, a vaccine is at best 1 year to a year and a half away. Okay, 1 year to a year and a half away. It's not months away. So with the coronavirus spreading unpredictably and Americans bracing for an increasing impact at home, the Federal Reserve made an emergency interest rate cut earlier on Tuesday, slashing the benchmark U.S. rate by 0.5 percentage point. When this was announced earlier today, we saw the stock market go up. The stock market was in positive territory earlier today, up around 300 points, something like that. It ended almost 800 points down. This is on top of, now we saw on Monday, coming off of the worst week since 2008. We saw Monday, the stock market gained about 1,200 points, but today is down almost 800. NBCnews.com is a good article dealing with this. Dow closes almost 800 points as reality of epidemic sinks in. Dow closes down almost 800 points as reality of epidemic sinks in. Nervous traders loaded up all day on quote unquote safe haven assets such as gold and treasury notes, pushing yields to record levels. Okay, so they're taking money out of the stock market because there's uncertainty. Read this article here. We're going to give you a number of sources. So I want you to go read this information. We'll post these articles here on the thread of our broadcast. We'll post some of them here on our Facebook fan page, the African History Network. Also, Dr. Boyce Watkins has been doing videos dealing with how the coronavirus is impacting the stock market, what to do, etc. Okay, so check out some of those videos as well. All right, Antonio, Cynthia, Adrian, how's everybody doing? Everybody share this broadcast on your Facebook fan page, the African History Network. Okay, I'm sorry, everybody share this. Follow us on our fan page, the African History Network. Everybody share this broadcast on your Facebook page, okay? All right, so we saw the Federal Reserve made an emergency interest rate cut earlier on Tuesday, slashing the benchmark U.S. rate by 0.5 percentage point. Now, the central bank has not made an emergency move like this since late 2008. It was also a sign that global central banks are prepared to act to contain the economic fallout from the coronavirus. And this was the G7 talked about this today as well. The move came after Donald Trump in a tweet called for a quote unquote big interest rate cut by the Federal Reserve, quote, to make up for China's coronavirus situation and slow down, end quote. Now, the markets quickly rallied after the Federal Reserve announced the decision. The rebound came after a volatile morning with futures pointing positive and then making a U-turn. Meanwhile, South Korean President Moon Jae-in, I think it's pronounced J, in declared war on the coronavirus has as government officials were placed on 24-hour alert and health tests expanded in virus hit areas. Okay, as health tests expanded in virus hit areas. The number of confirmed cases in South Korea tops 5,000. So South Korea has declared war on the coronavirus. The 5,000 cases declared in South Korea is the most outside of China. I'm going to show you a map here in just a minute worldwide where the coronavirus is hitting. New York Times has a really good map dealing with the worldwide impact of the coronavirus. Now, about 70 countries have reported incidences of the virus, with the number of cases in the United States topping 100 across 15 states. Okay. Now, we know last week, Donald Trump kept saying it was 15, 15, 15, when at the time it was about 64. All of those people were not Americans, but they were here in the US. If you saw my show Sunday night, and it's here on our Facebook fan page, the African History Network, and on my YouTube channel, Michael Imhotep, the African History Network show from, what was that, March 1st, 2020. One of the things I talked about was the New York Post has an article about this, as well as the Washington Post, how the Trump administration was not prepared to handle this pandemic. And February 20th, 2020, the New York Post reported coronavirus infected Americans flown back to US on plane full of healthy people. Now, I shared this when this article came out. I shared this on our fan page, the African History Network. It got over 6,000 likes. This deals with how incompetent the Trump administration is in general in handling this tragedy, this pandemic. Coronavirus infected Americans flown back to US on plane full of healthy people. The 14 coronavirus stricken, now this is from February 20th, okay? The 14 coronavirus stricken Americans evacuated from a cruise ship in Japan were flown back to the US on a plane full of healthy people against advice from the CDC, a report said Thursday. Okay, now the Center for Disease Control, the experts at the CDC, were saying do not fly these sick people back on a plane full of healthy people. The State Department, ran by Mike Pompeo, Secretary of State, overruled the experts at the CDC. We go back to February 17th. We look at the reporting for the New York Post. 14 Americans aboard evacuation plane from Japan stricken with coronavirus. Okay, so when we go back and look at the spread of this and what's taking place, we go and we see these articles going back showing how the Trump administration has mishandled this. 14, now this is the reporting from February 17th. 14 Americans being evacuated by plane from Japan to the U.S. are disembarking a cruise ship have tested positive for the coronavirus, officials said Monday. The infected were among a group of over 300 U.S. citizens who were allowed off the coronavirus-stricken Diamond Princess cruise ship Sunday, according to the U.S. State Department. U.S. officials said they learned of the positive test results as the evacuees were preparing to return to America on 2 chartered Boeing 747s. Quote, these individuals were moved in the most expeditious and safe manner to a specialized containment area on the evacuation aircraft to isolate them in accordance with standard protocols, end quote, the statement said. So read the rest of this. But what happened was they were put on to be flown back. Oh, so when you hear about the Diamond Princess cruise ship, this is where that comes in, okay? They were flown back on a plane of 300 healthy people. And the other people on the plane who were healthy didn't know there were 14 people on the plane with the coronavirus. They found out afterwards, okay? So we're gonna post these 2 articles from the New York Post, one from February 17th, 2020, then the other one from February 20th, 2020, coronavirus infected Americans flown back to US on plane full of healthy people, all right? The Washington Post has reporting on this as well. Coronavirus infected Americans flown home against CDC's advice. The Trump administration has been at war with scientists. We know Trump thinks climate change is a hoax. He has systematically been slashing the budgets of various health agencies, okay, whether it's the Center for Disease Control and others. If we look at February 20th, 2020, New York Post picked up the reporting from the Washington Post. Coronavirus infected Americans flown home against CDC's advice. In the wee hours of a rainy Monday, more than a dozen buses sat on the tarmac at Tokyo's Haneda Airport. Inside, 328 weary Americans wearing surgical masks and gloves waited anxiously to fly home after weeks in quarantine aboard the Diamond Princess cruise ship, the luxury liner where the novel coronavirus had exploded into a ship-wide epidemic. But as the buses idled, U.S. officials wrestled with troubling news. New test results showed that 14 passengers were infected with the virus. The U.S. State Department had promised that no one with the infection would be allowed to board the planes. A decision had to be made: let them fly or leave them behind in Japanese hotels. In Washington, D.C., where it was still Sunday afternoon, a fierce debate broke out. The State Department and a Trump administration health official wanted to forge ahead. The infected passengers had no symptoms and could be segregated on the plane in a plastic-lined enclosure. But officials at the Center for Disease Control and Prevention, see, the CDC ain't just the Center for, it's not just the Center for Disease Control, it's the Center for Disease Control and Prevention. They're trying to prevent the spread of diseases. Officials at the Center for Disease Control and Prevention disagreed with the Trump administration and the State Department. They contended they could still spread the virus. So, because what we know about the coronavirus is even if you don't have symptoms, you can still spread it. The experts at the CDC are telling the State Department, don't put those people, even if they don't have symptoms, whatever it is, don't put them on the plane with healthy people. The State Department overruled the experts at the CDC. The CDC believed that the 14 people should not be flown back with uninfected passengers. Quote, it was like the worst nightmare, end quote, said a senior U.S. official involved in the decision, speaking on the condition of anonymity to describe private conversations. Quote, quite frankly, the alternative could have been pulling grandma out in the pouring rain and that would have been bad too, end quote. The State Department won the argument, but unhappy CDC officials demanded to be left out of the news releases that explained that infected people were being flown back to the United States, a move that would nearly double the number of known coronavirus cases in this country. The tarmac decision was a pivotal moment for U.S. officials improvising their response to a crisis with few precedents and extraordinarily high stakes. Efforts to prevent the new pathogen from spreading have revealed the limits of the world's readiness for an unprecedented public health emergency. In the worst case scenario, COVID-19, which is the coronavirus, a flu-like respiratory infection could become a full-blown global pandemic. Navigating the crisis has required delicate medical and political judgments. The decision to evacuate the Americans from the Diamond Princess cruise ship came only after infections on the cruise ship spiked and passengers revealed their grim living conditions. Read this full article here. Now, this is from the Washington Post, February 20th, 2020. The article from the New York Post that I shared with you, they picked up the reporting from the Washington Post. We've seen this thing spread since then, since the reporting from February 20th. Name of this article from the Washington Post, coronavirus infected Americans flown home against CDC's advice. Okay. See, this is an example how elections have consequences. All right. And this is what people don't understand. This is what I was trying to explain to people in 2016. Dude, this ain't about just one person versus another person. There are 4,000 positions Trump had to fill in his administration. Okay. This is an example of how government impacts your life, and the decisions made by government impacts your life. Okay, so let's go. So that was from February 20th. Let's go to the updates. Just want to give you a little background information here because this is a lot. Okay. And also NBCnews.com has a really, really good article I read. Where did the new coronavirus come from? Where did the new coronavirus come from? Past outbreaks provide hints. Okay, so I'll give you some of that information as well, because I've been reading a number of different sources on this. All right. Okay, so let's go back to the updates here. And how's everybody doing? Let's see who we have here. Carl, Joseph, Moose, Rake. Okay, everybody. And then also, if you like this type of information, you could donate to the African History Network. We have Cash App now, $ the AHN Show through Cash App, $ the AHN Show through Cash App, and then also PayPal, paypal.me/the AHN Show, paypal.me/the AHN Show, or at our website, AfricanHistoryNetwork.com. Click on the yellow donate button. That helps us keep doing the research, stay on the air, finance a Sunday night show, etc., pay the bills, etc. I hope to see what you're saying is very real, bro. I hope they see what you're saying is very real, bro. That's what Moose Rake said. Well, that's why I'm giving you the sources. You don't have to believe me. You can go research this yourself. Okay. So proper documentation ends all conversation. Okay, let's continue here. Let's see, where are we? Okay. All right. So China, the epicenter of the outbreak and still the worst hit, announced its lowest number of new cases since late January. They announced 125 new cases in 24 hours. That's the lowest number of new cases since late January, and 31 deaths, bringing its total to 80,151 infections and 2,943 deaths. So the majority of the infections, the majority of the deaths we're seeing in China. The country has pledged to help other nations hit by the outbreak, offering advice to Iran, which has reported 2,336 confirmed cases and 77 deaths. Okay, so if we look at Washington State health authorities have confirmed 27 coronavirus cases, including 9 deaths, one of which occurred last week. The World Health Organization said that COVID-19 has killed about 3.4% of those diagnosed with the illness globally, higher than what was previously estimated. Previously estimated is that COVID-19 kills 2.3% of the people infected. whereas the flu kills 0.1% infected. So now the reporting is that COVID-19, according to the World Health Organization, kills 3.4% of those diagnosed, which is it's deadlier than the flu. The flu, as of right now, kills more people annually, yes, but percentage-wise of those infected, the COVID-19 kills more people percentage-wise as infected. As this grows, okay, those numbers could change. Okay, hopefully it's less deadlier. Hopefully it's not like the 1918 flu pandemic that killed 50 million people worldwide. Hopefully it's nothing like that. But this is why we have to monitor this. Okay, so the Department of Health and Human Services, HHS, the U.S. Department of Health and Human Services, sent a memo Tuesday, March 3rd, to members of Congress in response to questions about an HHS whistleblower report. However, some congressional members said the memo was inadequate and did not address their concerns. So there was a report, and I talked about this some on my Sunday night show. Okay, and the Sunday night show, we're going to put that in audio podcast format, because all these broadcasts, we put them in audio podcast format. So if you go to AfricanHistoryNetwork.com, on the homepage, click on listen to podcasts. We have a lot of stuff in audio podcast format, about 1,000 episodes going back 10 years, going back to 2010. Okay, so wherever you get your podcast from, just search for the African History Network show. We're on iTunes, Castbox, Acast, FM Player, Stitcher, TuneIn. So wherever you get your podcast from, search for the African History Network. Okay, so Washington Post reported on February 27th, 2020, U.S. workers without protective gear assisted coronavirus evacuees, HHS whistleblower says. So this is another whistleblower coming out during the Trump administration, all right? And it was today that the Department of Health and Human Services sent a memo to members of Congress in response to this HHS whistleblower. A little bit of the reporting from the Washington Post. Officials at the Department of Health and Human Services sent more than a dozen workers to receive the first Americans evacuated from Wuhan, China. And this is where the coronavirus is believed to began, in Wuhan, China. Officials at the Department of Health and Human Services sent more than a dozen workers to receive the first Americans evacuated from Wuhan, China, the epicenter of the coronavirus outbreak, without proper training for infection control or appropriate protective gear, according to a whistleblower complaint. The workers did not show symptoms of infection and were not tested for the virus. The workers did not show symptoms of the infection and were not tested for the virus, according to lawyers for the whistleblower, a senior HHS official based in Washington who oversees workers at the Administration for Children and Families, a unit within the Department of Health and Human Services. So what they're saying is that because these HHS workers were not given the appropriate gear or the appropriate training to deal with the coronavirus, they can become infected and they can spread it to other people. The whistleblower is seeking federal protection, alleging she was unfairly and improperly reassigned after raising concerns about the safety of these workers to HHS officials, including those within the Office of Health and Human Services Secretary Alex Azar. You see Alex Azar in press conferences. We saw Alex Azar Saturday in press conferences and other press conferences. Alex Azar is the Secretary of the Department of Health and Human Services. The whistleblower was told February 19th that if she does not accept the new position in 15 days, which would be March 5th, she would be terminated. So we see alleged retaliation against whistleblowers, just as we did with the whistleblower that dealt with the July 25th, 2019 telephone call between Donald Trump and Vladimir Zelensky, the new president of Ukraine, which led to the impeachment of Donald Trump. We saw retaliation against a whistleblower. We saw retaliation against those who testified, Lieutenant General Colonel Vindman, Sondland, Ambassador Sondland, etc. We saw retaliation there. We're seeing retaliation against this whistleblower who is trying to save people's lives. The whistleblower has decades of experience in the field, receiving 2 HHS Department Awards from Secretary of Health and Human Services, Alex Azar, last year in 2019, and has received the highest performance evaluations, her attorney said. The complaint was filed Wednesday with the Office of the Special Counsel, an independent federal watchdog agency. The whistleblower's lawyers provided a copy of a redacted 24-page complaint to the Washington Post. A spokesman for the Office of the Special Counsel confirmed that it has received the complaint and assigned the case. Okay, the complaint alleges that Health and Human Services staffers were, quote, improperly deployed, end quote, and were not properly trained or equipped to operate in a public health emergency situation. Okay, the complaint from the whistleblower alleges that Health and Human Services staffers were improperly deployed and were not properly trained or equipped to operate in a public health emergency situation. The complaint also alleges the workers were potentially exposed to coronavirus because appropriate steps were not taken to protect them, and staffers were not trained in wearing personal protective equipment, even though they had face-to-face contact with returning passengers. The workers were in contact with passengers in an airplane hangar where evacuees were received, and on 2 other occasions when they helped distribute keys from room assignments and hand out colored ribbons for identification purposes. Okay, so once again, we see a debacle and incompetence allegedly in the way this is being handled. The whistleblower in her complaint states that, quote, appropriate steps were not taken to quarantine, monitor, or test the workers during their deployment and upon their return home, end quote. The repatriated Americans were among those evacuated from Wuhan, China, and quarantined on military bases in California and Texas because they were considered at high risk for contracting the flu-like illness. Okay, okay, you can read the rest of this, okay? But you get the idea. So this is from February 27, 2020, Washington Post. U.S. workers without protective gear assisted coronavirus evacuees, HHS whistleblower says. Okay, so you have members of Congress asking for information regarding this new whistleblower. What's going on with this? Okay, so check this out. All right, so let's go back to the updates here. All right, so now when we look at the state of New York, the state of New York reported its second coronavirus case. A 50-year-old man in Westchester County, a suburb of New York. New York Governor Andrew Cuomo said he is pushing to provide paid sick leave and job protection for coronavirus patients. Chile and Argentina, when we look at the countries of Chile and Argentina, they reported their first infections of the coronavirus as cases of the virus slowly start to increase in Latin America. Chile confirms first case of coronavirus. Chile announced on Tuesday its first case of the coronavirus as cases continue to pop up around Latin America. The health ministry said the patient is a 33-year-old male in Talca, T-A-L-C-A, a city south of the capital of Santiago, who recently returned from travels through Southeast Asia and Spain. The case was announced shortly after Argentina confirmed a case in a man who recently returned from Italy. Okay, let's see here. More than, so it was reported on Tuesday, March 3rd, more than 120 Diamond Princess cruise ship evacuees to be released from quarantine in Texas. Okay. They're going to be released by federal officials from quarantine on Tuesday at Joint Base San Antonio Lakeland. San Antonio Mayor Ron Nirenberg confirmed. Now, Mayor Nirenberg told the Washington Post that he is grateful for our state and local medical officials, as well as the on-the-ground boots from CDC, Center for Disease Control. He said that he was satisfied with the plan for the evacuees release because the Centers for Disease Control and Prevention had changed its testing protocols. Okay. Let's see here. All right, so we saw the U.S. stock market today drop almost 800 points. This was after the Federal Reserve's emergency rate cut failed to bring calm, extending the mayhem that has defined the markets for days over growing concerns the coronavirus will blunt economic growth. So we see various corporations either canceling conferences or restricting travel by plane of employees. Also in the state of Washington, we see schools being closed in the state of Washington. Let's see, if we look at the reporting from NBC News, let me flip over to this. 4 more, so this is from March 2nd, 2020, Monday, March 2nd, 2020, 4 more coronavirus deaths reported in Washington state, bringing the death toll to 6. 5 victims were from Kings County and 1 was from Snohomish County, officials said. The Seattle area deaths are the first in the U.S. due to coronavirus. At least 6 people have died in Washington state from the coronavirus after 4 more deaths were reported on Monday, March 2nd. We see that Seattle and King County officials told reporters that it had documented at least 14 cases of the coronavirus, leading to 5 fatalities. A short time later, Snohomish County Health District spokeswoman Heather Thomas confirmed a coronavirus-related death was of a man from her jurisdiction, bringing the state's death toll to 6. Quote, "We expect the number of cases will continue to increase in the coming days and weeks, and we are taking this situation extremely seriously," said Dr. Jeff Dutchin, D-U-C-H-I-N, who is the Chief Health Officer for the Seattle and King County Public Health Agency. He went on to say the risk for all of us becoming infected will be increasing. And although most of the cases will be mild or moderate, the infection can cause a serious illness, and there's a potential for many people to become ill at the same time, end quote. Now, the 5 people who died in King County in the state of Washington were 2 men in their 50s and 70s and 3 women. 1 of the women was in her 70s and 2 in their 80s. The Snohomish County death was a man in his 40s. Okay, let's see here. Now, you had nearly a dozen schools were closed in Western Washington on Monday, March 2nd, over fears of the virus. Now, if we look at, let's see here. Let me look at my notes because I have notes of the updates also. So just bear with me a minute here as we look at this. Okay, so that was, we'll post a link to this article here. That was from March 2nd, 2020, NBCnews.com. 4 more coronavirus deaths reported in Washington state, bringing death toll to 6. Okay, so let's post that article here. How you doing, Audra in California? Moves Rake, Shirley. Okay, how's everybody doing? Everybody share this broadcast. Invite your friends to tune in also. Be sure to follow us on our Facebook fan page, The African History Network, The African History Network, and my YouTube channel, Michael Imhotep, I-M-H-O-T-E-P. Okay, so let's continue here. And what I'm going to do, I want to refresh the screen here because updates are coming in. And we'll also look at, so while I do that, let's look at the live updates from NBC News, because I'm looking at the Washington Post has really good, really good updates. I subscribe to the Washington Post. I read articles on them every day, as well as New York Times. I have digital subscriptions to the Washington Post and New York Times. Okay. If we look at, let's look at the, let's update, let's refresh this and look at, because I have NBC News. NBC News has live updates as well, live blog from NBC News. Coronavirus updates live, U.S. death toll rises to 9. The pressure on countries to respond forcefully to the spread of the coronavirus grew on Tuesday, March 3rd, with the United States announcing an emergency interest rate cut. So the Federal Reserve reduced interest rates by 0.5%, signaling concern that business across the globe will slow as the number of cases and deaths increase. Around 40 people have been reported dead in the last 24 hours due to the coronavirus in countries outside of China, more than the 31 new deaths reported in mainland China in the same period. Okay, this is the first time since the virus started spreading that deaths in China did not outnumber those in the rest of the world. In total, at least 3,100 people have died, including 9 in the state of Washington. The Federal Reserve on Tuesday announced the biggest interest rate cut. Okay, so we talked about that. Donald Trump has asked Congress for $2.5 billion to combat the virus. Many in Congress are saying you need more than that. You had a lot of Democrats in Congress who said you need more than that. Now, New Hampshire, this just in, New Hampshire confirmed second coronavirus case, okay? And this was updated at 5:55 p.m. Eastern Standard Time. A second case of coronavirus has been confirmed in New Hampshire. The patient is a close contact of the state's first case, okay? Who state health officials said defied directions to self-isolate. Let me repeat this. A second case of coronavirus has been confirmed in the state of New Hampshire. The patient is a close contact of the state's first case, okay, of the coronavirus, whose state health officials said defied directions to self-isolate. On Tuesday, the New Hampshire Department of Health and Human Services said the first patient attended an invitation-only private event on Friday, February 28th, despite the instruction from public health officials to remain isolated. As a result, the state issued an official order to keep the patient in isolation. That first patient is an employee of Dartmouth Hitchcock Medical Center. Now the facility is monitoring anyone who has been in close contact with that person. Dartmouth Hitchcock Medical Center said it's unaware of any patient exposures. It's unclear whether the second patient was exposed as a result of the first patient's broken isolation. All right, now, Dr. John Torres, another update here from NBC News. Dr. John Torres shares latest updates, okay, on the coronavirus. Let's see here, CDC issues, guys. Okay, so the Center for Disease Control has issued guidance that came out today, an update came out today, on how to limit exposure at polling places. We know this is Super Tuesday. Millions of people across the country are going to vote. Working at a polling station help reduce the risk to respiratory diseases like COVID-19 by routinely cleaning and disinfecting frequently touched surfaces and voting associated electronics. They have a link here to learn more as well. Let's pull this link up here. We'll post this here. This is from cdc.gov, Center for Disease Control. The CDC also has a lot of information there dealing with COVID-19 that you can read. Recommended precautions for preventing spread of COVID-19 in election polling locations, including cleaning and disinfecting. Okay, so check this out. We'll post this link here. If you know anybody that's working at a polling place, you may want to send them this link, text them this link, what have you. Okay, this is real. So this is not to try to just scare everybody. We shouldn't be in a panic, but we should be cautious. Okay. All right, let's go back to the live updates from NBC News. Archdiocese of Chicago issues virus guidance to priests. So I saw stories dealing with like the Catholic Church, how the Catholic Church was going to stop. They were going to be cautious with people drinking the wine. Because see, in Catholic, so I grew up Catholic till I was 13, right? So in Catholic Church, you drink a sip of wine, which is symbolic of the blood of Jesus the Christ, or Yeshua. And the wine is poured into the large cup, like I forgot what they called it, and then you stand in line. You get a wafer, the communion wafer, which is symbolic of the body of Christ, and you take a drink of the wine, but everybody drinks out the same cup. Okay, so if you've never been to Catholic church or you haven't seen this, okay, I remember this. All right, so now they're saying they're not going to have everybody drink out the same cup. I don't know whether they're going to go buy party cups from the liquor store or what. I'm not sure, but everybody ain't drinking out the same cup anymore. So Archdiocese of Chicago issues virus guidance to priests, with 4 cases of coronavirus reported so far in the state of Illinois. The Archdiocese of Chicago has released guidelines aimed at preventing the disease from being spread during Mass. First and foremost, all priests, deacons, altar servers, and others are required to wash their hands before Mass and use an alcohol-based antibacterial before and after distributing Holy Communion. And instead of placing the host on the tongue as it is customary, priests will place it in the hands of parishioners. So historically, when you got communion, you stand in line to get communion, the priest would place the wafer in your mouth. Okay. They said they ain't doing that anymore. All right. They're going to put it in your hand. Okay. They also advise to refrain from shaking hands when it comes time to exchange the sign of peace. Okay. They said a nod will do. So you have these different changes that are taking place as precautions. Okay, sign of the times, elbow bump edition. So you have, I see a lot of the doctors that are interviewed on MSNBC saying don't shake people's hands, do an elbow bump. Some people do a fist bump, do an elbow bump, etc., to reduce the spread of the virus. We see corporations that are canceling conferences. Okay, canceling conferences is going to impact the amount of people who are traveling, which is negatively going to impact the stocks of airlines. So Google cancels its major, reported today. Google cancels its major developers conference. Google has canceled its largest annual conference for software developers, Google I/O, citing concerns around the coronavirus, according to numerous people who have posted screenshots of emails from Google notifying them of the change. The 3-day event had been scheduled to begin May 12th near Google's corporate headquarters in Mountain View, California. CNBC confirmed the cancellation with the company. Okay, so we'll post, we'll post this article from CNBC.com. Google cancels its annual conference due to coronavirus. This is going to impact the stocks of airlines. This is going to impact the stocks of hotels and the business of hotels as well. This is going to happen now when you go. So I travel a lot. I stay at hotels. Businesses around the hotel feed off of the traffic coming into the hotel, the restaurants, nightclubs, things like this. Okay, so this is going to have a ripple effect throughout the economy. So read this article from CNBC.com. Google cancels its annual conference due to coronavirus. We'll post a link here also. We'll post a link here on the thread of the broadcast so you can check all this stuff out. So there are numerous, there have been numerous corporations who are canceling conferences, who are restricting the travel of their employees for business purposes, etc. And then also we're going to have to see how does this impact spring break as well. So we know spring break probably come up in April. How will this impact spring break? Okay, let's go back to the reporting from, let's go back to the live updates from NBC News. Let's look at the article from earlier today. Dow closes down almost 800 points as reality of epidemic sinks in. So the Federal Reserve's historic emergency rate cut was not enough to assuage Wall Street on Tuesday, with the Dow Jones Industrial Average plunging wildly to end the day by almost 800 points. So the Dow is a collection of 30 corporations, okay? It's only 30 corporations represented on the Dow Jones Industrial Average. Nervous traders loaded up all day on safe haven assets such as gold and treasury notes, pushing yields to record levels amid growing realization that the coronavirus might not be as fleeting as Donald Trump's administration has conveyed. Trump is trying desperately to keep the stock market afloat, okay? Because he knows if the stock market tanks, this impacts the overall economy. He knows he's not going to be reelected. So he's out here lying, saying that a vaccine is coming very soon. The vaccine is just months away. Dr. Anthony Fauci is saying at best, it's going to be a year to a year and a half before you have a vaccine. The federal, and so the Trump administration is at war with the scientists. Okay. And if we look at the article, I talked about this Sunday night on my show. If we look at the article from businessinsider.com, let me pull this up because I have about literally 50 tabs open right now. Trump spent the past 2 years slashing the government agencies responsible for handling the coronavirus outbreak. This is from businessinsider.com. Trump spent the past 2 years slashing the government agencies responsible for handling the coronavirus outbreak. Okay. Donald Trump insisted on, so let's look at the date of this. February 25th, 2020. February 25th, 2020, just a few days ago. Donald Trump insisted on Tuesday that, last week Tuesday, that the coronavirus known as COVID-19 is under control because China is working very hard to contain the spread. We saw that's not true. We saw it's not under control. China is working hard, but it's spread to over 60 countries now. Okay, I think it's 90 countries, they said. Trump's comments are at odds with reality. The same day, the Center for Disease Control announced that it expected the virus to spread enough within the U.S. to cause a, quote, disruption to everyday life, end quote. The Trump administration has also spent the past several years dismantling the very government programs responsible for combating a global health crisis. Donald Trump spent much of last week, Tuesday, reassuring the public that the coronavirus is under control. Okay, let me skip over some of the BS he was saying. Fears of a pandemic come after the Trump administration spent the past several years gutting the very government programs that are tasked with combating such a crisis. In 2018, for instance, the Center for Disease Control cut 80% of its efforts to prevent global disease outbreaks because it was running out of money. Ultimately, the department went from working in 49 countries to just 10 countries. One of the countries that was cut was China. So if we look at the article, I talked about this on my Sunday night show, the African History Network show. If we look at the article from foreignpolicy.com, Rachel Maddow talked about this last week on the Rachel Maddow show. Nicole Wallace talked about this on Deadline White House. Foreignpolicy.com had an article from January 31st, 2020. Trump has sabotaged America's coronavirus response. Trump has sabotaged America's coronavirus response as it improvises its way through a public health crisis. The United States has never been less prepared for a pandemic. Here's an excerpt of the article. In May of 2018, Donald Trump ordered the National Security Council's, NSC, the National Security Council's entire global health security unit shut down, calling for reassignment of Rear Admiral Timothy Zimmer and dissolution of his team inside the agency. The month before, which would have been April 2018, then White House National Security Advisor John Bolton, John Bolton, who didn't want to testify in front of the House of Representatives, and then in the U.S. Senate during the impeachment trial, he said, "I'll testify," and he's trying to push his book instead of doing the right thing and testifying. He was more concerned about pushing his book. Then National Security Advisor John Bolton pressured Rear Admiral Timothy Zimmer's DHS counterpart Tom Bossert to resign along with his team. Neither the National Security Council nor Department of Health and Human Services, Department of Homeland Security, DHS, Department of Homeland Security, neither the National Security Council nor Department of Homeland Security epidemic teams have been replaced. This is an example of how elections have consequences. This is an example of how you need a president who has judgment, who has some damn common sense. Okay? Because Trump has been he's been slashing the budgets and laying off getting rid of all these scientists in a number of different departments. You can't do that. They're there for a reason. So neither the National Security Council nor Department of Homeland Security epidemic teams have been replaced. The global health section of the CDC Center for Disease Control, the global health section of the Center for Disease Control was so drastically cut in 2018 that much of its staff was laid off, and the number of countries it was working in was reduced from 49 to merely 10. The reporting from businessinsider.com, part of that comes from this article from foreignpolicy.com. I read the article from foreignpolicy.com. So when I saw them cite this in Business Insider, I knew where it came from. Meanwhile, throughout 2018, the U.S. Agency for International Development and its director, Mark Green, came repeatedly under fire from both the White House and Secretary of State Mike Pompeo. Now, it was the State Department. Mike Pompeo is the director of the State Department. It was the State Department that overruled the experts from the Center for Disease Control and put those 14 people infected with the coronavirus on the plane with 300 healthy people to fly back to the U.S. This is Mike Pompeo's Secretary, State Department. So, meanwhile, throughout 2018, the U.S. Agency for International Development and its director, Mark Green, came repeatedly under fire from both the White House and Secretary of State Mike Pompeo. And though Congress has so far managed to block the Trump administration plans to cut the U.S. Public Health Service Commission Corps by 40%, because that's what Trump wanted to do, the disease-fighting cadres have steadily eroded as retiring officers go unreplaced. So you have a hollowing out when it comes to these scientists who are experts. Some staff have been cut, others are retiring and are not being replaced, which leaves the U.S. vulnerable to a pandemic like the coronavirus. MSN.com, not MSNBC, MSN.com, Microsoft. They have a news source. They reported Trump administration to cut funds from health programs to pay for coronavirus response. Trump administration to cut funds from health programs to pay for coronavirus response. The Trump administration will pay for the coronavirus response in part by cutting funds from other health programs, including one that pays for heat and cooling assistance for the poor. These are your taxpayer dollars. And this is what happens when you have a fool running the government. Okay. All right. So let's continue. Let me give you this article here. This is from businessinsider.com. We'll post a link here. Okay, so they cited the article from foreignpolicy.com. I broke some of that down for you. Here are some of the actions the Trump administration undertook to dismantle government spending programs related to fighting the spread of global diseases, according to Foreign Policy, foreignpolicy.com. Shutting down the entire global health security unit of the National Security Council, eliminating the U.S. government's $30 million complex crisis fund, reducing national health spending by $15 billion, consistently attacking Mark Green, the director of the U.S. Agency for International Development. Okay, so you can read the rest of this, right? There was another article from Vox.com that dealt with how Trump has, it was shutting down a Obama era initiative. What was that? Because I have a bunch of articles here. A crucial program. Here we go. The PREDICT program. PREDICT was a pandemic preparedness program that thrived under the George W. Bush administration and the President Barack Obama administration. The program was canceled in October of 2019. Vox.com has an article, and we just posted this again yesterday. A crucial federal program tracking dangerous diseases is shutting down. A crucial federal program tracking dangerous diseases is shutting down. Ever since the 2005 H5N1 bird flu scare, the U.S. Agency for International Development has run a project to track and research these diseases. The name of the project is called PREDICT, PREDICT. At a cost of $207 million during its existence, the program has collected more than 100,000 samples and found nearly 1,000 novel viruses, including a new Ebola virus. But on Friday, in October 2019, the New York Times reported that the U.S. government is shutting down the program. According to its former director, Dennis Carroll, the program enjoyed enthusiastic support under President George W. Bush and President Barack Obama, but, quote, things got complicated, end quote, in the last few years until the program essentially collapsed. That's from Vox.com. We'll post a link here, okay? See, all this, politics impacts every aspect of our life, from the water we drink to the food we eat to the air we breathe. Politics is the legal distribution of scarce wealth, power, and resources, and the writing of laws, statutes, ordinances, amendments, and treaties, their adoption, interpretation, and enforcement. Politics impacts all of this, okay? And many times people don't understand this, okay? And this deals with how elections have consequences. These are a whole lot of programs many people don't even know exist. Okay, let's see here who we have here. Okay, Quentin, how's everybody doing? Okay, everybody share this broadcast. Read these articles that I'm giving you. Here's the article from businessinsider.com. All right, African-American business owners, post the name of your business here on the thread of the broadcast. We'll let you know how you can advertise with the African History Network. Email us at customerservice@africanhistorynetwork.com, customerservice@africanhistorynetwork.com. Current promotions going on for a few more days, Bob. 1 month, get 2 months free. Okay, so we have a couple of new advertisers here. Sage and Elm Apothecary creates unique products, especially with you in mind. At Sage and Elm Apothecary, they use simple ingredients such as whole fruits, herbs, and vegetables. Each product crafted offers a unique plant-based experience. Their holistic approach to self-care formulate their product inventory. They are proud to serve their community of plant-based product supporters and offerings for the entire family. Sage and Elm Apothecary designs over 60 different beautiful handcrafted soaps, natural toothpaste, hydrating oils, deodorants, face masks, shampoos, conditioners, and much more. They extend their service for added convenience, as well as classes and special occasion events. You can find Sage and Elm Apothecary online at sageandelmapothecary.com. Okay, APOTHECARY. We'll post a link here. Sageandelmapothecary.com. You can find their pop-up shops and vending events throughout the year to make your purchase a rich sage and elm experience. Okay, so visit their website, sageandelmapothecary.com. Also, we have another new advertiser. So we know that African Americans do travel. Now, I may slow down a little bit with the coronavirus, but African Americans do travel. Well, blacklionleather.com allows you to carry your culture with you in the form of leather travel accessories. Blackleatherlion.com is unique, a unique travel accessory brand. They manufacture and sell online to the culturally inspired African-American traveler. And they are 100% African-American owned and operated. Their tagline is carry your culture, carry your culture. Visit their website, blacklionleather.com, for more information, and you can see the accessories they have there, and you can place your order today so you'll be ready to travel and carry your culture with you the next time you travel. blacklionleather.com. All right, let's continue here. Let's check out I want to look at some more of the updates. And okay, I gave you the article from businessinsider.com. Trump spent the past 2 years slashing the government agencies responsible for handling the coronavirus outbreak. All right. We're going to look at some more of the updates here. And I want to look at, where did the coronavirus come from? Okay. There's a few things I want to do before we get out of here. So let's see here what we do next. Let's look at where it's hitting worldwide. New York Times has a good map to show where it's hitting worldwide. So just bear with me, because I got about probably about 60 tabs open now. Where is that map from the New York Times? Let's see, I had it. Hold on, New York Times. Okay, here we go. Yeah, coronavirus map tracking the spread of the outbreak. Okay, so far you have 92,700 people worldwide who have the coronavirus. As of Tuesday afternoon, at least 3,157 people have died. All but 212 of the people who died are mainland China. Okay, so let's turn on the screen share so you can see this. Hopefully the computer doesn't freeze up with the screen share on. Let's turn this on. Okay, so these are the latest stats reported by the New York Times. 92,700 people worldwide. We see they have a legend here, confirmed cases. Travel, but be careful. At risk groups, avoid travel. Avoid all non-essential travel. So we see China, 80,100 plus cases in China. South Korea, 5,100 cases. Japan, 900. Iran, 2,300 plus. Japan, 900 plus. Italy, 2,500 plus. France, 200 plus. And then we look at the U.S., 100 plus in the U.S. So we see avoid all non-essential travel. That includes Iran, Italy, China, South Korea. We see at-risk groups avoid travel. That would be Japan. Let's see, that's the darker color. Then travel, but be careful. That looks like US and a lot of these other places, Mexico, Nigeria. So Nigeria and Senegal in the last couple of days reported their first cases. We see Nigeria, Egypt, Algeria, they're reporting their first cases. Also, Senegal reported its first case. We scroll down, we see Brazil has 2 cases, Australia 38, Singapore over 100, Indonesia 2. So we're seeing this spreading. Okay, so check this out. We'll post a link here. Check this out from the New York Times. They're keeping track of this coronavirus map, tracking the spread of the outbreak. Okay, let's look at, there was a 1918 flu pandemic. And I wanted to talk about this on my Sunday night show, but I only have 2 hours here, so I didn't get a chance to talk about it. Washington Post had a really good article. I read an article from National Geographic from probably about 2014 dealing with this 1918 flu pandemic that killed 50 million people worldwide. Washington Post has an article from February 29th, 2020. Trump is ignoring the lessons of the 1918 flu pandemic that killed millions, historians say. Trump is ignoring the lessons of the 1918 flu pandemic that killed millions, historians say. Okay, so we're going to give you the link of this article also. We're going to get into this. Before we get out of here, we'll look at some more updates from the Washington Post and NBC News dealing with what's taking place. Also, you can donate to the African History Network. If you like this type of information, you can donate to the African History Network, paypal.me/the AHN show, or $ the AHN show through Cash App. And then also at our website, AfricanHistoryNetwork.com. Click on the yellow donate button right on the homepage. That helps us keep doing the research, stay on the air, broadcast our Sunday night show, finance our Sunday night show, etc. And then all of my DVD lectures are available at our website, AfricanHistoryNetwork.com, AfricanHistoryNetwork.com. And then we have the new the 15 DVD bundle pack, the Black History Month bundle pack, which is good any time of the year also. That's on the homepage of our website, and I just posted a link for that also. Okay, let's see who we have here. Bernice, how you doing, Bernice? Okay, let's look at the one dealing with the pandemic of the flu pandemic from 1918. So the first wave wasn't that bad. In the spring of 1918, a new strain of influenza, also known as the flu, hit military camps in Europe on both sides of World War I. Okay, so 1918 is the last year of World War I. World War I was 1914 and 1918. Soldiers were affected, but not nearly as severely as they would be later. Even so, Britain, France, Germany, and other European governments kept it a secret. They did not want to hand the other side a potential advantage. Spain, on the other hand, was a neutral country in World War I. When the disease hit in Spain, the government and newspapers reported it accurately. Even the king got sick, okay? The king of Spain. So months later, when a bigger, deadlier wave swept across the globe, it seemed like it had started in Spain, even though it had not started in Spain. Simply because the Spanish told the truth, the virus was dubbed the Spanish flu. So when you study this 1918 pandemic, you hear it referred to many times as the Spanish flu. Now, as fears about the coronavirus spread, at least one historian is worried that the Trump administration is failing to heed the lesson of one of the world's worst pandemics. Don't hide the truth, okay? Don't hide the truth. It says, quote, they, referring to the Trump administration, are clearly trying to put the best possible gloss on things and are trying to control information, end quote, said John M. Barry, author of the book, The Great Influenza, the epic story of the deadliest plague in history. He said this in a phone interview with the Washington Post. Now, when the second wave of the Spanish flu hit globally, quote, there was outright censorship in Europe, author John M. Barry said. In the United States, they did not quite do that, but there was intense pressure not to say anything negative, he went on to say. Now, news about the war was carefully controlled by the Committee on Public Information, which was an independent federal agency whose architect was publicist Arthur Bullard, B-U-L-L-A-R-D, who once said, quote, the force of an idea lies in its inspirational value. It matters very little if it is true or false. The force of an idea lies in its inspirational value. It matters very little if it is true or false. Now, the CPI's Committee on Public Information released thousands of positive stories about the war effort, and newspapers often republished them verbatim. So when the Spanish flu spread across the United States in the fall of 1918, both the government and the media continued the same rosy strategy, quote, to keep morale up, end quote. President Woodrow Wilson, who was the president at the time, we know President Woodrow Wilson was also the president who in 1915 had a private screening of the movie The Birth of a Nation at the White House. That Woodrow Wilson. President Woodrow Wilson released no public statements. Surgeon General Rupert Blue said, quote, there is no case for alarm if proper precautions are observed, end quote. Another top health official dismissed it as, quote, ordinary influenza by another name, end quote. Now that sounds like the latest recipient of the Presidential Medal of Freedom, that great American Rush Limbaugh, talk show host Rush Limbaugh, okay, who's downplaying the severity of the coronavirus, all right? But it was not. The Spanish flu had a mortality rate of 2%, much higher than seasonal influenza strains and similar to early estimates about the coronavirus. Okay, so if we look at this, as I said, now just last week, it was reported that the coronavirus killed about 2.3% of those who are infected. Now we see that's increased to 3.4% as the World Health Organization reported today. We saw this from the updates from the Washington Post. The World Health Organization said that COVID-19 has killed about 3.4% of those diagnosed with the illness globally, higher than what was previously estimated. We see that influenza annually kills about 0.1% of those infected. Okay, so we saw something similar to this back in 1918. This is why history is so important. This is why historians are so important, because we look to the past to see how were these various types of issues handled. What did we learn from the successes? What did we learn from the mistakes? The Spanish flu had a mortality rate. So back in 1918 with the Spanish flu, we saw the U.S. government downplaying it. Okay. We saw another top health official, U.S. health official back at that time, who dismissed the Spanish flu as ordinary influenza by another name, but it was not. The Spanish flu had a mortality rate of 2%, which was much higher than seasonal influenza strains and similar to some early estimates about the coronavirus. And we have seen the deadliness of the coronavirus increase in just a week. It also differed in who it killed. The Spanish flu of 1918. It also differed in who it killed. Seasonal flu tends to be worst for the very young and very old. Spanish flu was deadliest in young adults, such as soldiers crowded into military camps. Okay, so the flu generally hits the very young and the very old. It is deadliest to the very young and very old. The Spanish flu epidemic of 1918 was deadliest among young adults as opposed to children. It especially hit young adults who would say in the military, crowded into military camps. Now, for the most part, the media followed the government's lead and self-censored dire news. That made everything worse, author John Barry said. For example, in Philadelphia, local officials were planning the largest parade in the city's history. Just before the scheduled event, about 300 returning soldiers started spreading the virus in the city of Philadelphia. He said, and basically every doctor, they were telling reporters the parade should not happen. The reporters were writing the stories. Editors were killing them. Editors were killing the story. The reporters are writing the stories about what's taking place and the fact that the doctors are saying that the parade should not happen. The editors of the newspapers were censoring this and killing the stories. The Philadelphia newspapers would not print anything about it, author John Barry said. The parade was held, and 48 hours later, Spanish flu slammed the city of Philadelphia. Even once schools were closed and public gatherings were banned, city officials claimed it was not a public health measure and there was no cause for alarm. Philadelphia became one of the hardest hit areas of the country. The dead lay in their beds and on the streets for days. Eventually, they were buried in mass graves. More than 12,500 residents died, according to the Philadelphia Inquirer. If a newspaper reported the truth, the government threatened the newspaper. If a newspaper published the truth, the government threatened the newspaper. The Jefferson County Union in Wisconsin warned about the seriousness of the flu on September 27, 1918. Within days, an Army general began prosecution against that newspaper under a Wartime Sedition Act, claiming it had, quote, depressed morale, end quote. Now, this sounds similar to Trump's war on the media, Trump's war on the press trying to tell the truth, okay? And Trump trying to, and Trump not wanting the truth to get out about a number of things. Okay, we see how Trump, what he is saying is in direct contrast to what the experts are saying, what Dr. Anthony Fauci and other experts are saying. As the pandemic raged through October of 1918, Americans could see with their own eyes that the quote unquote absurd reassurances coming from local and national officials were not true. The crisis of credibility led to wild rumors about bogus cures and unnecessary precautions. The Spanish flu ultimately killed about 50 million people worldwide, including 675,000 people in the United States. So a lot of people don't know about this history. There have been some articles written in the past couple of weeks about this. I read an article from National Geographic, which went back to 2014. There's an article from National Geographic came out in 2014 about the Spanish flu pandemic of 1918. Okay. Name of that article, we'll pull that one up here for you. I talked about that a little bit on my show Sunday night, but I ran out of time. We had a number of callers who called in. The article from the National Geographic, written by Dan Vergano, from January 24, 2014, 1918 flu pandemic that killed 50 million originated in China, historians said. Chinese laborers transported across Canada thought to be source. Okay, we'll give you the link to this article also. So all this ties into history. This deals with how history is in the headlines, and this is something that I deal with as well. All this ties into a history, and we can look into history to see how did we deal with these problems in the past. And you see some of my lectures, you hear me say people's history and culture teaches them how to deal with the problems of the past in the present and the future to meet the needs of the community. Okay, and this is an example, not specifically to African Americans, but this is an example dealing with American history. So this is why we must not just study African American history. We have to study American history in general, because American history ties into African American history, and African American history is a branch of African history. This is why this book is so important. 10-minute guide to U.S. history from Britannica.com, which gives a good overview chronologically of American history going back hundreds of years. And they go back to, Native Americans. Okay, they go back to Native Americans and deal chronologically with everything from the Boston Massacre to the American Revolutionary War, drafting the U.S. Constitution, all different types of things like this, slavery, World War I, World War II, etc. Okay, I got this at Sam's Club for $7.78. This is from Encyclopedia Britannica. All right, so this is a really, really good book to give you a basic overview chronologically of U.S. history. Okay, so let me give you the link to this article here. 1918 flu pandemic that killed 50 million originated in China, historians say. Then I want to go back to this article from, okay. And then I'm going to go back to this article from Washington Post. This is just, now I've read a lot more articles dealing with this. I'm just giving you a few here so you can give you a foundation. Okay. and so we can educate ourselves on this. And then I'm sharing I'm sharing some videos also from the brother from Health by Any Means Necessary as well, Ed. So we have some more videos coming from him. I'm going to share also. All right, let's see here. Okay, Washington Post. Let me, okay. And yeah, okay, this is the flu pandemic. All right, so let's go back to this 1918 Spanish flu pandemic. Okay, so Philadelphia became one of the hardest hit areas of the country. More than 12,500 residents in Philadelphia died. And then also we saw 675,000 people nationwide died, 50 million worldwide. This is according to the Center for Disease Control and Prevention. Even President Woodrow Wilson caught the Spanish flu in the middle of negotiations to end World War I. Author John Barry said, quote, "I think the number one lesson that came out of the experience is that you want to prevent panic. If you want to prevent panic, you tell the truth. If you want to prevent panic, you tell the truth." So they should have this. So Health and Human Services and the Trump administration should have the doctors out in the forefront doing interviews on all the Sunday shows, things like this, especially Dr. Anthony Fauci, because Dr. Fauci is one of the leading experts and he takes you step by step through this. And when you're armed with the proper information, it reduces people's panic. It reduces fears. Okay, it reduces the level of fear. So in 2005 and 2006, author John Barry contributed as a subject matter expert to an influenza pandemic plan created by the Center for Disease Control and Prevention. He said he felt it was his job to beat the tell the truth drum. Okay. Now with coronavirus, John Barry said he's a little worried about the plan being followed. He doesn't think the Trump administration is, quote, outright lying, but they're definitely giving you interpretations that seem to be the best case scenarios, end quote, he said. He's particularly concerned about Donald Trump's decision to have Vice President Mike Pence oversee the response instead of an expert such as Dr. Anthony Fauci, the doctor who heads the National Institute of Allergy and Infectious Diseases at the National Institute of Health, the NIH, National Institute of Health, or National Institutes of Health, I should say. Given the credibility crisis that happened with the 1918 pandemic, John Barry said that was the exact wrong thing to do. Okay, putting having Vice President Mike Pence coordinate this effort, especially with the lack of credibility that this administration has. Okay, he should not do that. Now with the Ebola crisis, President Obama put Joe Biden in charge of handling this, but the Obama administration was more so ahead of the curve in containing the Ebola crisis as opposed to this administration. So check out this article from Washington Post. Trump is ignoring the lessons of 1918 flu pandemic that killed millions, historian says. But to learn from the lesson, you have to learn the history in the first place. And Trump is ignorant of history. We see that. Trump is totally ignorant of history. All right. I want to look at a couple more things. And then we'll go back to the live updates here in just a minute. I'm going to refresh the screen here. NBCnews.com has a good article. Where did the new coronavirus come from? Past outbreaks provide hints. Although finding the source would not necessarily help scientists develop vaccines or other direct treatments, it could provide crucial pieces of information on how it emerged and evolved. Okay, so this was from February 28th, 2020, written by Denise Child. As scientists and public health officials around the world scramble to contain the deadly coronavirus outbreak, some researchers are also racing to solve the enduring mystery of where the newly identified virus came from. The coronavirus, which first sickened people in China in December of 2019, is thought to have passed from animals to humans, like many similar pathogens, but nothing has been confirmed yet by any peer-reviewed scientific research, global public health agency, or academic expert. Beyond that, little is known about its origin. Okay. Now, one theory is that it passed from a bat to a human and then mutated in the human and then is able to be passed from human to human. Although finding the source would not necessarily help scientists develop vaccines or other direct treatments, it could provide crucial pieces of information. It could provide crucial pieces of information on how it emerged and evolved. And scientists are using lessons learned from previous outbreaks to know how to approach this one. Early research suggests that the virus closely resembles a known coronavirus harbored in horseshoe bats, according to Ian Jones, I-A-N, Ian Jones, a professor of virology at the University of Reading in England. Ian Jones said, what is not clear is the steps that move the virus out of the bat into some intermediate source or sources, and then finally into man. Now, the virus origin has been the focus of conspiracy theories and other forms of misinformation. In an interview with Fox News on February 16th, Senator Tom Cotton, Republican from Arkansas, suggested that the coronavirus may have come from a virology laboratory in Wuhan, China, where the outbreak emerged. Others went further by raising the possibility that the virus was a leaked bioweapon. Now, there's no evidence to substantiate any of that. But scientists say the virus similarities to known coronaviruses in animals, particularly bats, rule out the idea that it was created in a lab. And repeat, scientists say the virus similarities to known coronaviruses in animals, particularly bats, rule out the idea that it was created in a lab. To trace a virus to its source, scientists typically look for clues in its molecular makeup. Chinese scientists published the coronavirus sequence genome, G-E-N-O-M-E, genome, less than 2 weeks after the first case in humans was reported. A lightning fast development made possible by advancements in technology. Now, Gene Olinger, O-L-I-N-G-E-R, is a Maryland-based virologist at MRI Global, which is a scientific research organization that is helping to develop diagnostic tools for the coronavirus. Gene Olinger said this would have taken us 6 months to a year to do before. We had those first sequences almost immediately. That's unheard of. Okay. Now let me go to this clip here. This is from this is Ali Velshi on MSNBC, and Ali Velshi is explaining the coronavirus. Let's see here. Let me pull up this clip. This is from MSNBC. What is the coronavirus and what are the symptoms? I shared this on my show Sunday night. Just a second. Yeah, what is the coronavirus and what are the symptoms? This is from MSNBC.com. We'll pull up this clip here. All right, just a minute. I thought I had it pulled up already. This another clip. This because he gives a really. I want you to hear this because he gives a really Good explanation of it. Okay, so the virus genome can tell scientists everything about its source, but the string of DNA sequences functions almost like the string of DNA sequences functions almost like a blueprint for this type of detective work. Now, Carolyn McHammer is a professor of cell biology at Johns Hopkins at the Johns Hopkins University School of Medicine in Baltimore. Carolyn McHammer said the closest bat virus that we've seen is not able to infect human cells, so there had to be some type of intermediate animal. The bat virus can infect an intermediate animal, and during that replication, mutation arise that could promote infection in humans if they are in close contact. Now, many coronaviruses are zoonotic diseases, Z-O-O-N-O-T-I-C, zoonotic diseases, which means they spread from animals to people. And there is precedent for coronavirus outbreaks that originate in bats and spill over to humans through an intermediate animal. An outbreak of severe acute respiratory syndrome, or also known as SARS, S-A-R-S, SARS, severe acute respiratory syndrome. There was an outbreak of this in 2003. And in the 2003 outbreak, is thought to have spread from bats to civet cats, C-I-V-E-T, civet cats, before the first human patient was infected. And the Middle East respiratory syndrome, or MERS, M-E-R-S, Middle East respiratory syndrome, which is another type of coronavirus, which was first reported in Saudi Arabia in 2012, most likely passed from bats into dromedary camels before spilling over into humans. Now, public health officials suspect that the current outbreak may have originated at a live animal market in Wuhan, China, where dozens of workers were infected at the outset. The market has been shut down, but tests on samples from the area have been inconclusive. In early February 2020, a group of Chinese scientists suggested that genetic analysis pointed to pangolins, P-A-N-G-O-L-I-N-S, which are scaly, long-snouted anteaters, as a likely source of the outbreak. This was early February 2020. Their research showed that genetic sequences of coronaviruses isolated from pangolins are 99% similar to those of the current variant. Now, Jones said the pangolin theory is plausible, but he cautioned that the findings have not yet been confirmed by independent scientific research. Researchers are also still unsure why this coronavirus was transmitted to humans. Mammals and birds are known reservoirs for coronaviruses, but the vast majority of them do not sicken people. And I'm queuing up this clip also. Quote, there are plenty of coronaviruses that cause disease in animal species, but they're not thought to be a risk to humans, Jones said. The mentality changed after the SARS outbreak, which spread to more than 24 countries and killed 774 people. All right. So let's go to this clip here. This is from February 27th, 2020. This is Ali Velshi on MSNBC. What is the coronavirus and what are the symptoms? What is the coronavirus and what are the symptoms?
Want to take a closer look at what Jake's been describing, what we're dealing with. Coronaviruses are a large family of viruses. The corona refers to these crowns. Looks like a crown that you're looking at it. It affects the respiratory system. COVID-19, which is causing all of the concern right now, is one of 7 coronaviruses that are known to infect humans. Most coronaviruses infect animals, bats, cats, birds. No one knows precisely where this particular virus came from. Now, the CDC says symptoms can include fever, cough, and shortness of breath. Some people experience mild symptoms. Others suffer from a severe illness that could lead to death. The CDC believes the symptoms may appear anywhere between 2 and 14 days after you're first exposed to it. COVID-19 can, as we just mentioned, be asymptomatic, meaning someone can be infected and not display any symptoms at all. The virus can spread from person to person, which has caused big worries about the rapid spread of the disease in public places like transportation hubs, sports stadiums, casinos, things like that. Scientists estimate that without effective containment measures, someone with coronavirus could, on average, infect between 1 and 4 people. Now, compare that with the seasonal flu, in which someone with the flu tends to infect roughly 1 to 2 people. So the rate of infection, in fact, is greater with coronavirus. Chinese researchers looked at more than 72,000 cases of COVID-19.
Yeah, I want to back that up.
Is greater with coronavirus. Chinese researchers looked at more than 72,000. Someone with the flu tends to infect roughly 1 to 2 people. So the rate of infection, in fact, is greater with coronavirus. Chinese researchers looked at more than 72,000 cases of COVID-19 diagnosed through February 11th, and they found that most people experienced mild symptoms, but many of the people who with coronavirus could, on average, infect between 1 and 4 people. Now, compare that with the seasonal flu, in which someone with the flu tends to infect roughly 1 to 2 people. So the rate of infection, in fact, is greater with coronavirus. Chinese researchers looked at more than 72,000 cases of COVID-19 diagnosed through February 11th, and they found that most people experienced mild symptoms, but many of the people who died were either elderly or were critically ill with chronic conditions like a heart disease or diabetes. Chinese researchers estimate that the mortality rate for COVID-19 is 2.3%. That means just over 2% of people infected will die. The mortality rate for the seasonal flu is much lower than that. It's 1/10 of 1%. Both are much lower than the nearly 10% death rate for SARS and 34% for MERS.
Okay, so that was from MSNBC. That was from February 27, 2020. That was a good overview of it from Ali Velshi. But since then, as I reported at the beginning of the broadcast, we see that the World Health Organization today reported that COVID-19 so far has killed about 3.4% of those diagnosed with the illness globally, as opposed to the 2.3% that the flu, as opposed to the 2.3% that was reported last week that it has killed globally. It has now killed 3.4% of those infected, whereas the flu annually kills 1/10 of 1% that are infected. Okay, so it is deadlier percentage wise. Let me see here. I'm just looking at updates here from Washington Post. We're about to get out of here. So let's see here. Because we have some updates. Okay, India restricts drug and drug ingredient exports amid disrupted supply chains. India is restricting the export of more than 24 pharmaceutical drugs and ingredients due to the impact of the coronavirus epidemic on supply chains. The medicines include antibiotics, progesterone, and vitamin B12. Reuters reports India is one of the world's leading suppliers of generic drugs, but relies on China for many of its ingredients. In the United States, around a quarter of medicines come from India. Stephen Hahn, HAHN, Commissioner of the U.S. Food and Drug Administration, told lawmakers Tuesday that India, quote, has restricted the export of 26 active pharmaceutical ingredients for export, which represents about 10% of their export capacity, end quote. He said his office is working to assess what these changes will mean for the U.S. drug supply. Last week, Stephen Hahn said the United States is closely monitoring the pharmaceutical supply chain and doing, quote, everything possible to mitigate the shortage, end quote. Okay. Now, okay, so we already reported second coronavirus case in New Hampshire. First patient went to event after being told to self-quarantine, authorities say. So we talked about that at the beginning. Santa Clara health officials announced 2 new coronavirus cases, raising county's total to 11. Health officials in Santa Clara County, California, announced 2 new confirmed coronavirus cases Tuesday, bringing the county's total to 11. So this was reported 6:20 p.m. Eastern Standard Time on March 3rd. At a Tuesday afternoon news conference, the county's health officer, Sarah Cody, C-O-D-Y, said officials had not determined how the 2 new patients became infected. She said area schools were considering their procedures and warned county residents that the risk of severe illness associated with coronavirus increases with age. She said, quote, the people at greatest risk of severe sickness are those 80 and over. She reminded those listening that people with underlying medical conditions and those with compromised immune systems face the greatest risk. Now, first was updated this evening. First responders, when we look at Kirkland, Washington, first responders remain in quarantine after potential exposure at Washington nursing home. Now, Kirkland, Washington is a city of 90,000 people northeast of Seattle that has been the epicenter of the outbreak, much of it linked to a nursing home, and they remained in emergency mode too. The nursing home remained in, Kirkland, Washington remains in emergency mode as of Tuesday. Fire Chief Joseph Sanford said 26 fighters and 3 public officers, including one who was added to the group Monday night, remained in mandatory quarantine. Most are at home. A dozen of them were exhibiting mild flu-like symptoms. City workers called them twice a day to check in and are urging them to take their temperatures often. For those holed up in a firehouse near the nursing home and in another undisclosed location, latex gloved workers are ferrying them fruit, vegetables, and breakfast, lunch, and dinner, he said. They are under quarantine mainly because of their exposure to the Life Care Center of Kirkland, Washington. This was the nursing facility in a tree-lined residential area just 6 minutes from Fire Station 21. The outbreak has taken a quarter of the Kirkland Fire Department offline, but officials said the department remains fully staffed. One firefighter is back on the job after completing a 14-day quarantine period. Now, Sanford, a 63-year-old who has been with the department since his early 1920s, said since his early 20s, said it is accustomed to handling emergencies such as the health-related calls that drew them often to the nursing home. Okay, so we already reported that Google has canceled a developer event and halts international travel over coronavirus concerns. Also, we know that yesterday, on Monday, we know that Senegal reported, Senegal and Nigeria reported cases also. I mentioned that briefly at the top of the broadcast. That would have been March 2nd, because I have updates from March 2nd also. So let me look at this here. French citizen. Okay. A French citizen was diagnosed with the virus in Senegal on Monday, March 2nd, marking the country's first known case and only the second in sub-Saharan Africa. Elsewhere, Indonesia, one of the few large nations thought to be free of the virus, said Monday it had 2 confirmed cases, while others were reported from Australia to India to Portugal. All right, so we have at least 2 sub-Saharan cases as of Monday, March 2nd. Sub-Saharan Africa. Okay, so I'm looking at these other updates. Okay, this is one I missed. Okay. Democratic senators confront VP Mike Pence over coronavirus response. All right. So Democratic senators confronted Mike Pence and other top officials Tuesday, March 3rd, over the Trump administration's response to the coronavirus outbreak, voicing deep frustrations afterward that their questions were not answered. Senators Pat Murray and Maria Cantwell of the state of Washington, which has had the only U.S. death so far from the virus, led the questioning in the closed-door lunch, multiple senators said. They demanded to know when more test kits would become available. Senator Patty Murray said later that for now, many residents are simply being told to stay home if they don't feel well, an untenable approach for many. Senator Maria Cantwell from the state of Washington said, testing. Be honest with people. Everybody hit on it. Tell us when the tests are going to be available. So one of the biggest problems here is that there's a lack of tests for hospitals to use. And as more tests are being made available, you're going to see the number of cases skyrocket. What we're looking at now, as far as in the US, as far as the number of cases, which is now at about 91 or something like that, that's only based upon people who have been tested. There's a whole lot of people who is suspected have it, but they haven't been tested yet. And then if we look at the in the state of Washington, it's suspected, let's see, there was an update. It's because it's suspected that for 6 weeks, people were infected and spreading it, but they didn't know that they had it. So let me find that update here. That was reported on March 2nd. Yeah. Okay. In the United States, tests have taken place at a far slower pace. A genetic analysis suggested that the coronavirus, which causes a highly infectious respiratory disease called COVID-19, has been spreading undetected for about 6 weeks in the state of Washington. The U.S. Food and Drug Administration on Saturday took steps to sharply expand testing. So what I'm going to do is let's pull up. I want to give you the actual article, if we can get that. Can I give you the actual article? Because I went and printed up a lot of these updates from the Washington Post, and I've seen different articles, but I want to give you the actual article with this. Let's see. Let's go here, because I added this stuff to my notes, all these updates. I added this to my notes for this coming Sunday show. So last Sunday, I had like 25 pages of notes. No telling what I'm going to have this coming Sunday, because I do research constantly. So let's look at this. This was March 2nd. This was the update for March 2nd, 7:43 p.m. Eastern Standard Time. So that is hyperlink. Let's grab that link and open link. And we'll give you the article here. Let's see if that'll open up. Okay, just a second here. Copy hyperlink. That's what I want. Let's do that. Copy hyperlink. And I'll give you the actual link to this article here. Oh yeah, this is one I read. I actually went and read this article. Coronavirus may have spread undetected for 6 weeks in Washington state, which reported first 2 deaths in U.S. So yeah, this was from March 1st, 2020, this article. And then I guess they reported an update the next day. The coronavirus has been circulating undetected and possibly infected scores of people over the past 6 weeks in Washington state, according to a genetic analysis of virus samples that has sobering implications for the entire country amid heightening anxiety about the likely spread of the disease. Okay, so this article was posted March 1st, 2020, 10:53 p.m. Eastern Standard Time. That is Sunday night, okay? The researchers conducted genetic sequencing for 2 virus samples. One is from a patient who traveled from China to Snohomish County in mid-January and was the first person diagnosed with the disease in the United States. The other came from a recently diagnosed patient in the same county, a high school student with no travel-related or other known exposure to the coronavirus. The 2 samples look almost identical genetically, said Trevor Bedford, a computational biologist at Fred Hutchinson Cancer Research Center in Seattle, Washington, who announced the results of the research on Twitter late Saturday night. Quote, "This strongly suggests that there has been cryptic transmission in Washington state for the past 6 weeks," Bedford wrote. He went on to say, "I believe we're facing an already substantial outbreak in Washington state that was not detected until now due to narrow case definition requiring direct travel to China," end quote. So one of the things that happened was that the definition of it was expanded, and more testing took place, even though there's still a lack of tests nationwide to be given to the hospitals and things like this so they can test people who have symptoms. As more tests are given, you're going to see the number of diagnosed cases in this country skyrocket. Officials in Seattle and King County on Sunday, March 1st, announced that 4 more people have tested positive. Okay, so now we know it's more than 4. Read this article. Coronavirus may have spread undetected for weeks in Washington state, which reported first 2 deaths in U.S. This is why things like this, you can't take the approach that we just gonna lay up, we just gonna get rid of all these scientists and things like this. They just stand around doing nothing, and then when we need them, we'll hire them back. This is something you have to stay ahead of. There was on my Sunday night show, I shared a segment from the Rachel Maddow show, and I don't have time to play the clip here, but I want to give you the name of the clip. I want you to go listen to it, and we'll post a link of it here, because in the clip, in the description of it, there's actually 2. Go listen to the show from Sunday night, and we have it here on our Facebook fan page, the African History Network, and it's on our YouTube channel, Michael Imhotep. It's from March 1st. Okay, it was a clip from the Rachel Maddow show from February 27th, 2020. February 27th, 2020. Name of the clip at msnbc.com is called "Trump Gives Incoherent Briefing on Coronavirus, Contradicts CDC." Trump gives incoherent briefing on coronavirus, contradicts CDC. In the description of the clip, and actually I think I have it because I'm looking at my notes from my show Sunday night, and I've updated those notes, and I'm constantly updating this stuff here because this is a very fluid story. So I'm gonna give you the link here. We'll post this. in the description of the clip, it says Donald Trump gave a press conference on COVID-19, naming Vice President Mike Pence the head of his administration's response to the potential pandemic. So this was the press conference that took place last week, Wednesday. Asked about the likelihood of a U.S. outbreak, Trump said, quote, "I don't think it's inevitable," end quote, which directly contradicts officials from the Center for Disease Control who say the spread of the coronavirus in the U.S. is a matter of when, not if. They said, no, it's inevitable that it's going to spread. Now, I'm not sure Trump knows what inevitable means, okay? That means, no, it's unavoidable. The experts from the Center for Disease Control are saying it's unavoidable. Trump at the press conference said, well, I don't think it's inevitable. He has no clue what he's talking about. He's trying to keep the stock market propped up. Okay, so Trump also defended now pay attention to this. Trump also defended proposed budget cuts to the Center for Disease Control by saying that he's a, quote, business person. "I don't like having thousands of people around when you don't need them," end quote. This fool said, "I'm a business person. I don't like having thousands of people around when you don't need them." These are your taxpayer dollars in action. This is an example how elections have consequences. Okay. And I'm going to pull this up. I want to see if there's a article with this quote. Let's pull this up here. But I gave you the link from Rachel Maddow show. Oh yeah, they have the fact check of the conference from the Washington Post, and I think I read this fact check. This is from February 28th. So yeah, I read this fact check already. We'll get this to you because I already have it bookmarked as well. I have thousands of articles bookmarked. But let's see, where is this in here where this fool said this, man? Oh my God. Okay, so let's look at this here. When you have, Trump apparently, so Trump said, "We know all the good people. It's a question I asked the doctors before. Some of the people we cut, they haven't been used for many, many years. And if we have a need and we can get them very quickly. And rather than spending the money, and I'm a business person, I don't like having thousands of people around when you don't need them. When we need them, we can get them back very quickly. For instance, we're bringing some people in tomorrow that are already in this, great government that we have. And very specifically for this, we can build up very, very quickly. And we've already done that. I mean, we really have built up. We have a great staff." This is this BS, Trump. See, you can't come into the government with this corporate downsizing mentality like this. There's a reason why these positions exist. My degree is in business administration. I worked in corporate America. I've managed companies, things like this. Government don't work like that. Especially when you're dealing with health agencies. So Trump apparently thinks, the fact checking from the Washington Post, Trump apparently thinks he's cut the staff of the Center for Disease Control by thousands of people. But overall, the agency has shrunk by only about 600 people, or 5% from December 2016 through March 2019, according to the Office of Budget and Management data. More detailed employee numbers contained in agency budget documents from 2017 and 2021 show that full-time employment has actually increased in CDC branches that focus on global health, an increase of 14%, and infectious diseases up 20%. The Trump administration sought to reduce the budget for the CDC, but Congress resisted those efforts. Now, there have been so there was proposed new budget cuts that Congress resisted, but there has been previous cuts to the CDC and other health agencies. Perhaps Trump has been listening too much to the Democratic debates. In the most recent debate, former New York Mayor Mike Bloomberg claimed, quote, he's defunded Centers for Disease Control, CDC, so we don't have the organization we need, end quote. And former Vice President Joe Biden said, quote, he's wiped all that out. He cut the funding for the entire effort, end quote. Neither claim is true. There have been cuts. There have been numerous cuts, but those two claims are not true. Nevertheless, it's jaw-dropping to hear Trump claim he can hire people quickly to fill any gaps, or that some doctors, quote, haven't been used for many, many years, end quote. New funding would need to be appropriated by Congress, and federal hiring is often slow and time-consuming, okay? So check this out from Washington Post. So this was fact-checking of his press conference that took place Wednesday, February 28th, okay? And that was a debacle of a press conference also. The one he did this past Saturday, he behaved much better in that one. It was still bad, but he behaved much better. But check out this fact checking here. We'll give you that. Yeah. So yeah, I'd already read that, and I had that bookmarked also. Okay. All right, African-American business owners, post name your business here on the thread of the broadcast. Email us at customerservice@africanhistorynetwork.com, customerservice@africanhistorynetwork.com, and we'll let you know how you can advertise with the African History Network and reach thousands of potential customers across the country. And we have some new advertisers also. Sage and Elm Apothecary creates unique products, especially with you in mind. Now they have products for the plant-based community, and they have designs of over 60 different beautifully handcrafted soaps, natural toothpaste, hydrating oils, deodorants, face masks, shampoos, conditioners, and so much more. Okay, visit their website, sageandelmapothecary.com, APOTHECARY, Sage and elmapothecary.com, and visit their website. But also you can find out about their pop-up shops and vending events throughout the year, various places that you can find them and make purchases also. Another new advertiser we have is blacklionleather.com, blacklionleather.com. Now, we know African-Americans travel, maybe slow down a little bit because of the coronavirus, but African-Americans do travel. We see a number of different travel shows and articles dealing with African-Americans traveling. And blackleather.com allows you to carry your culture when you travel through their leather travel accessories. Blackleather.com is a unique travel accessory brand. They manufacture and sell online to the culturally inspired African-American traveler, and they are 100% African-American owned and operated. Their tagline is carry your culture, carry your culture. So visit their website, blacklionleather.com, blacklionleather.com. Now, we know in 2020, a lot of people want to get their financial house in order. You may read blackenterprise.com. You may see some of the articles that we post here on our fan page dealing with economic empowerment and finance, things like this. Well, certified financial planner Martisha Patterson can help you with this. Now, you've seen some of the interviews I've done with Martisha Patterson. She's a certified financial planner with over 20 years in the wealth management industry. Okay, she can help you if you want to set up a budget, if you want to build generational wealth, etc. Contact her for a free consultation. Visit her website, pattersonplans17.com, pattersonplans, the number 17.com, or give her a call, 646-552-4384, 646-552-4384. Certified financial planner Martisha Patterson. She will help you with proven tools, techniques, and strategies so you can meet your financial goals. Now, a lot of people are looking for something to read, and author Teresa Roseman is the author of the book She Remembered Her Path. She Remembered Her Path. Now, this is a a poem which centers on a character named Sheteria. Sheteria is a woman who finds herself in trouble. Sheteria feels she cannot make decisions that were simple in her younger life. The fear is she has stepped off the path she has created and now needs guidance to return to her confident self. Find out what happens to Sheteria in the book She Remembered Her Path by author Teresa Roseman. It's available at eBay, Barnes & Noble, and Amazon.com. And it can also be found in Kindle form at Amazon.com as well. All right. So, hey, everybody, follow us on our Facebook fan page, The African History Network, The African History Network. Also follow us on our Facebook fan page. Follow us on our YouTube channel, Michael Imhotep, Imhotep on YouTube. Listen to the African History Network show. We're on Sundays, 9 p.m. to 11 p.m. Eastern Standard Time. We broadcast on 9:10 a.m. the Superstation WFDF, and broadcast on our Facebook fan page, The African History Network, and on our YouTube channel, Michael Imhotep, Imhotep. All right, look, hey, we have to get out of here. Remember, at the African History Network, we focus on educating, empowering, and inspiring people of African descent throughout the diaspora and around the world, because right now it's correct wrong behavior. Also, if you like this information, you could donate to the African History Network, $ the AHN show, through Cash App, $ the AHN show, or through PayPal, paypal.me/the AHN show. So that helps us keep doing the research. Finance our Sunday night show helps when I have to travel out of town to speak out of town. Let's see, the end of the month, end of March, I will be in Baltimore at I think it's the 19th annual Baltimore Natural Hair Care Expo. Should be there 2 days, at Saturday and Sunday. And I'll be doing workshops there dealing with great Black women in history, and dealing with some of the origins of dealing with some of the politics of African-American hair, natural hair, things like this. So look out for that as well. So remember, right now it's correct wrong behavior. It's not over till we win. Wakanda forever. And we'll talk to you next time. Peace.